Now, the next part of the tutorial is going to be based now on the investigations. So for the investigation, you need to know that you have to investigate the infection, you have to investigate the cause of the infection, you have to investigate the complication, you have to investigate also the background. Is it clear? Now, to investigate for the infection, necrotizing fasciitis clinical diagnosis. Now, with respect to the different infection that you have to note, is it clear? When you have an infection somewhere, if you want to know that there is an infection, generally you just do a collection of the sample of that infected area, and then you do a microscopy. Generally, when you are going to do microscopy, the first thing that you can use in order to support you to support your diagnosis of infection is just the imaging. Is it clear? You do imaging, provided you are not capable clinically. If you are capable of seeing, imaging is not going to help you. Is it clear? If you see that there is drainage from a particular area, is it clear? To support your infection, you are just going to say clinically you can see necrotizing fasciitis, or clinically you can see a limb swelling. Is it clear? But if it cannot be seen, you are going to use an imaging technique. Like in the case of the chest, you're going to use a chest X-ray. Is it clear? So that's an imaging technique that can help you to know that there is infection. There may be infections at the level of the chest. Is it clear? So you have imaging technique. So support your diagnosis, either clinical or imaging. Clinical is when you are capable of seeing the point of focus, while imaging is when you are not capable of seeing, particularly in pneumonia, where you are not seeing the lungs. You can do a chest X-ray to visualize the lungs. Is it clear? Particularly so those are the things that you can know in imaging to support your diagnosis. And now to confirm the diagnosis, generally you need to do an aspiration. Is it clear? You need to do an aspiration, or you need to do any form of collection of the sample of the drainage that is coming from that location, and then you do microscopy. Is it clear? Or analysis. Is it clear? When you are going to do microscopy, you are going to see that there is going to be an elevated number of white blood cells. Like in the case of meningitis, you do collection of the cerebrospinal fluid and you do analysis in order to, with microscopy, to see if there are white blood cells and there's other changes in biochemistry. In the case of the pneumonia, you do a sputum collection and then you do microscopy in order to find if there are white blood cells. Is it clear? In the case of a septic arthritis, you still do collection of with arthrosynthesis, and then you visualize if there is any abnormality with that. Is it clear? On the microscopy. So all that is what is going to help you to confirm that there is actually an infection in that location. Is it clear? You do aspiration and microscopy or analysis, or you can also do any collection, like in sputum, the patient need to cough. Like in the case of urinary tract infection, the patient need to urinate. So that is how you have to analyze in a patient that has infection to confirm that there's actually infection in that particular location. Now, the next thing is complication. For the complication, we talked about sepsis. In order for you to visualize sepsis, you need to support sepsis. To support sepsis, you are going to visualize with the full blood count, the CRP. Is it clear? Full blood count and CRP is going to tell you that there is sepsis. Full blood count, CRP is going to tell you that there is sepsis. Is it clear? So, the full blood count, how is going to tell you that there is sepsis? You can see a leukocytosis greater than 10,000. You see, or you are going to see a leukopenia less than 4,000, and the CRP is going to be elevated to tell you that there's an acute inflammation. Is it clear? So those are the elements that can help you to support that there is sepsis. And now to confirm that there is sepsis, you do a hemoculture. Is it clear? So hemoculture confirm that there is sepsis, and it's going to tell you the microorganism involved in that, and also the antibiotic that can treat that microorganism. So after the support and the confirmation of the sepsis, the next thing is to visualize the causative agent. Is it clear? So when you want to know the causative agent, you have to just do, instead you are not just going to do aspiration or collection with microscopy, but you are going to do aspiration and collection with culture and sensitivity. Like in the case of a sputum, you can do sputum culture and sensitivity to visualize the particular microorganism involved there. In the case of urinary tract infection, you can do a urine culture and sensitivity. So in this case, you do culture and sensitivity to know the particular microorganism in order to know the causative agent. And then the next one now is the background. Is it clear? For the background, how do you investigate? You investigate the background now based on the immunosuppression. This is where now you need to know now a tutorial on immunosuppressive state of a patient. What are the things that can result to immune suppression?